What helped with me? Again, serendipity does play a role in this sort of thing. So you just have to make yourself available. So I've spoken at our university because we're really close to the medical school. So we have a series of seminars. Again, it depends on the clinician availability whether they attend or not, but they tend to do the seminars with one clinician and one preclinical researcher in each session. And so the idea is the other thing is you kind of need to do that on the hospital grounds if you can, because you want to make it as easy for the clinicians to pop in as possible. You think we're busy being academics, but they can just sneak in into that session. And then having that preclinical session just let us kind of form some links with the clinicians. And like I said, it was our autoregulation work that really perked up their interest because it went counter to what they'd been taught in medical school. And so presenting that, kind of an update on physiology, if you like, presenting the data for that in a convincing and accessible way, then they come up afterwards and like, oh wow, I'd never thought about it that way. And then that's, you kind of keep those conversations going, and eventually now this is, they've got the clinical trial running for the blood pressure and stroke, and we're, now they're coming to us. So what we're doing now is almost reverse translation, where some of the clinicians will look at the clinical data and bring it back to us and say, this is what we see, can you help us explain it? And so we'll take that, kind of try and replicate that data in our models and feed back to them on what we think some of the mechanisms might be, and then we'll think together about, well, how does this influence, what we should think about, what's the next step to improve management of these patients, where should we take this?